Paroxetine stands as a beacon in the pharmacological management of psychiatric disorders, heralding a new era in the treatment of conditions that, until its introduction, challenged both patients and healthcare professionals alike. As a member of the Selective Serotonin Reuptake Inhibitors (SSRIs) class, paroxetine operates on the central nervous system by modulating the levels of serotonin, a neurotransmitter pivotal in regulating mood, anxiety, and other behaviors. The journey of understanding paroxetine begins with its development, marked by extensive research aiming to provide relief to those suffering from various mental health conditions. Its approval by regulatory authorities underscored the significance of its contribution to psychiatric medication, offering a new avenue for therapy. The relevance of paroxetine in contemporary medicine cannot be understated. Its role extends beyond mere symptom management. It offers individuals a chance at reclaiming their lives from the clutches of debilitating conditions. The exploration of its uses, benefits, and associated risks provides insight into its standing as a preferred treatment option for many healthcare providers. The discussion that follows aims to unravel the complexities of paroxetine, shedding light on the various facets that contribute to its prominence in the treatment of psychiatric disorders. In delving into the particulars of paroxetine, it is essential to approach the subject with a balanced perspective, recognizing both its potential to significantly improve quality of life and the caution needed when prescribing it. This exploration seeks to navigate through the intricacies of paroxetine, offering a comprehensive understanding that encompasses its applications, advantages, and the precautions necessary to mitigate risks associated with its use. Common uses of paroxetine. Paroxetine, with its multifaceted applications, serves as a cornerstone in the management of several psychiatric disorders. Its primary use in treating major depressive disorder, MDD, represents a significant advancement in addressing a condition that affects millions worldwide. The efficacy of paroxetine in alleviating the symptoms of depression, such as pervasive sadness, loss of interest in activities, and fatigue, has been well documented in numerous clinical trials. Its ability to restore the balance of serotonin in the brain plays a crucial role in mood regulation, offering hope to those engulfed in the shadows of depression. Beyond its application in treating depression, paroxetine is also a valuable asset in the arsenal against anxiety disorders. Conditions such as generalized anxiety disorder, GAD, panic disorder, social anxiety disorder, and post-traumatic stress disorder, PTSD, have been shown to respond favorably to treatment with paroxetine. The reduction in anxiety symptoms, frequency of panic attacks, and overall improvement in social functioning and well-being highlight the versatility of paroxetine as a therapeutic agent. The scope of paroxetine's utility extends to the treatment of obsessive-compulsive disorder, OCD, and premenstrual dysphoric disorder, PMDD, further illustrating its broad spectrum of action. In addressing the compulsions and intrusive thoughts characteristic of OCD, paroxetine provides a pathway to regaining control over one's life. Similarly, the management of PMDD with paroxetine addresses the severe mood swings, irritability, and discomfort that can disrupt daily living, affirming its role in enhancing patient quality of life across various conditions. Benefits of paroxetine. The benefits of paroxetine, while diverse, share a common theme: the potential to significantly improve the lives of those struggling with psychiatric disorders. One of the most pronounced advantages of paroxetine is its ability to alleviate the debilitating symptoms associated with depression and anxiety disorders. This improvement in symptoms can lead to enhanced daily functioning, enabling individuals to engage more fully in personal and professional endeavors. Moreover, the use of paroxetine is often associated with a favorable side effect profile compared to other antidepressants, particularly older tricyclic antidepressants. This aspect of paroxetine treatment can result in higher patient adherence, as the milder side effects are less likely to lead to discontinuation of therapy. The importance of this cannot be overstated, as consistent medication adherence is critical in managing chronic psychiatric conditions. Another benefit of paroxetine lies in its once-daily dosing schedule, which simplifies medication regimens and supports compliance. The convenience of a single daily dose, coupled with the medication's efficacy, makes paroxetine an appealing option for both patients and healthcare providers. This convenience factor, along with the medication's effectiveness, underscores the benefits of paroxetine in the long-term management of psychiatric disorders. Potential adverse effects of paroxetine. While paroxetine presents numerous benefits, it is imperative to acknowledge the potential adverse effects associated with its use. Common side effects, such as nausea, drowsiness, dizziness, and insomnia, though often mild, can nonetheless impact the daily lives of those taking the medication. Sexual dysfunction, another reported side effect, represents a concern that can affect adherence and patient satisfaction with treatment. More severe adverse effects, though rare, include an increased risk of suicidal thoughts and behaviors, particularly in young adults and adolescents. This risk necessitates careful monitoring by healthcare professionals, especially during the initial stages of treatment or when adjusting the dosage. Additionally, discontinuation syndrome, characterized by symptoms such as flu-like symptoms, sensory disturbances, and mood changes, can occur if paroxetine is abruptly stopped, highlighting the importance of gradual dose reduction under medical supervision. The potential for interaction with other medications also warrants consideration, as paroxetine can affect the metabolism of certain drugs, leading to increased levels and associated risks. This interaction underscores the necessity of a comprehensive review of a patient's medication regimen before initiating paroxetine, ensuring compatibility and minimizing the risk of adverse outcomes. Dosage recommendations for paroxetine. Determining the optimal dosage of paroxetine is a critical component of treatment, tailored to the individual's specific condition, severity of symptoms, and response to therapy. For major depressive disorder, the recommended starting dose is often low, gradually increasing to the standard therapeutic dose based on patient tolerance and clinical response. This cautious approach minimizes the risk of side effects and allows for the identification of the lowest effective dose for the individual. In the treatment of anxiety disorders, the dosage of paroxetine may vary, with some conditions requiring higher doses to achieve the desired therapeutic effect. The flexibility in dosing underscores the importance of individualized treatment plans, with adjustments made as needed to address the nuances of each patient's experience. Ongoing assessment of the efficacy and tolerability of paroxetine is essential, with periodic evaluations conducted by healthcare professionals to determine if dosage adjustments are necessary. This dynamic approach to dosing ensures that patients receive the most appropriate level of medication, optimizing outcomes while minimizing the risk of adverse effects. Dangers and precautions of paroxetine. The use of paroxetine, while beneficial for many, carries with it certain risks that necessitate caution. The potential for increased suicidal ideation, particularly in younger populations, requires vigilant monitoring and open communication between patients and healthcare providers. The importance of identifying and addressing these risks early cannot be overstated, as it directly impacts patient safety and treatment efficacy. Pregnant women or those planning to become pregnant should discuss the use of paroxetine with their healthcare provider, as it has been associated with risks to the fetus. This conversation is crucial in weighing the benefits of treatment against the potential risks, ensuring informed decision-making tailored to the individual's circumstances. Additionally, the risk of discontinuation syndrome emphasizes the need for a gradual reduction in dosage rather than abrupt cessation of treatment. This precaution minimizes the discomfort and potential complications associated with stopping paroxetine, facilitating a smoother transition off the medication when appropriate. Alternatives to paroxetine. For individuals for whom paroxetine is not suitable, or who experience adverse effects, several alternatives are available. Other SSRIs, such as sertraline and fluoxetine, offer similar benefits with potentially different side effect profiles, providing options for those seeking alternatives. Additionally, serotonin norepinephrine reuptake inhibitors, SNRIs, like venlafaxine and duloxetine, represent another class of medications used in the treatment of depression and anxiety disorders, offering a different mechanism of action. Psychotherapy, including cognitive behavioral therapy, CBT, and interpersonal therapy, IPT, serves as a non-pharmacological alternative that can be highly effective in managing psychiatric conditions. For some individuals, a combination of medication and psychotherapy may offer the best approach, addressing both the biological and psychological aspects of their condition. Lifestyle modifications, such as regular exercise, a healthy diet, and adequate sleep, also play a role in managing symptoms of depression and anxiety. These interventions can complement pharmacological treatments, contributing to overall well-being and symptom management. Frequently asked questions about paroxetine. What is the typical duration of treatment with paroxetine? The duration of treatment with paroxetine varies depending on the individual's condition and response to medication. For some, short-term treatment may suffice, while others may require long-term management. Regular consultations with a healthcare provider are essential to determine the appropriate duration of therapy. Can paroxetine be taken with other medications? Paroxetine can interact with certain medications, potentially leading to increased side effects or reduced efficacy. It is crucial to inform your healthcare provider of all medications you are taking, including over-the-counter drugs and supplements, to avoid adverse interactions. Is it safe to drink alcohol while taking paroxetine? Consuming alcohol while taking paroxetine is generally not recommended, as it can exacerbate the medication's sedative effects and increase the risk of side effects. Discussing alcohol consumption with your healthcare provider is important to ensure safe use of paroxetine. Conclusion: paroxetine, as a treatment option for various psychiatric disorders, offers significant benefits to those affected by conditions such as depression and anxiety. Understanding its common uses, benefits, potential adverse effects, dosage recommendations, and associated dangers allows for informed decision-making regarding its use. While paroxetine is not without risks, its potential to improve quality of life for many cannot be overlooked. Alternatives to paroxetine, including other medications and therapeutic approaches, provide options for comprehensive care tailored to the individual's needs. As with any medication, open dialogue with healthcare providers, careful consideration of the benefits and risks, and adherence to prescribed treatment plans are paramount in achieving optimal outcomes. In navigating the complexities of psychiatric treatment, paroxetine represents a valuable tool, offering hope and relief to those seeking to overcome the challenges of mental health conditions. Through informed understanding and careful management, the benefits of paroxetine can be harnessed, contributing to the broader goal of improved mental health and well-being.